Hey guys, so I'm just going to start talking about what the health promotion model is. So it was designed by Nola J. Pender to be a complementary counterpart to models of health protection. It defines health as a positive dynamic state rather than simply the absence of disease. Health promotion is directed at increasing a patient's level of well-being. Pender's model focuses on three areas. Number one is individual characteristics and experiences. Number two is behavior-specific cognitions and effects. And number three is behavioral outcomes. The theory notes that each person has unique personal characteristics and experiences that affects their subsequent actions. The health promotion model makes four assumptions. Number one is individuals seek to actively regulate their own behavior. Number two is individuals in all their biopsychosocial complexities interact with the environment, progressively transforming the environment as well as being transformed over time. Health professionals, such as nurses or occupational therapists, constitute a part of interprofessional environments, which exerts influences on people throughout their lifespan. And number four is self-initiated reconfigurations of the person-environment interactive patterns is essential to changing the behavior. So now I'm going to get into talking about my article. My article is called A Historical Review of Occupational Therapy's Role in Preventative Health and Wellness by Maggie Wrights. This aims to reflect on occupational therapy history in order to stimulate future research and clinical application in health promotion. Wrights discusses how occupational therapy recognizes the importance of preventative health, action, and promotion of wellness in healthcare in order to continue to meet this demand as a profession. The objective of this research is for readers to understand how health promotion in the past and how it can be better implemented in the future. Wrights successfully answered the objectives throughout this article by providing numerous historical milestones, such as AOTA conferences, AJOT newsletters, and the work of many idolized influencers in occupational therapy. The health promotion approach guided Wrights when discussing preventative interventions, financial constraints and supports, and programs that can be used as a resource. Wrights adequately incorporated health promotion into all historical examples conducted throughout this research. For example, she discussed how in the 1960s the health promotion model was emerging as an issue in the occupational therapy profession. At the 46th annual AOTA conference, it was brought to the public's attention that there would be an increasing concern for health maintenance and prevention of disease and disabilities. It was emphasized that occupational therapy needed to play a bigger role in this area of medicine, so AOTA updated the definition of occupational therapy in the handbook to include aspects of preventative health. Wright's historical review in some ways does not contribute to the understanding of health promotion, and in other ways does contribute to the understanding of health promotion. As a critique of this article, Wright should have begun by making a clear statement defining health promotion and why it is so important to our profession and in healthcare. This clear statement would have then been more accurately supported by the milestones in occupational therapy that she discusses as a part of our history. In other ways, it does contribute to the understanding of health promotion by providing many examples of cases when health promotion was not implemented. This was the case in the 1950s when occupational therapies solely abandoned this philosophy of preventative health. This helps readers understand what it is at loss for the health promotion approach. Overall, Wrights did a very good job explaining health promotion, and I thoroughly enjoyed reading this article.